When Jesus comes, when Jesus comes, when my Jesus comes.
Good afternoon, Bethany. I'm Dr. Edwards, and joining me today, facilitating our class, Managing Through the Mess, is Dr. Faye Bonner. She is a mental health professional therapist and educator. We'll be discussing some issues, how to manage through a season of mess, and how to develop certain components and approaches to develop healthy mental health practices. Considering our cultural climate in a season where COVID-19 and the protests of injustice had impacted our lives on every basis, issues caused and triggered physical, emotional, and spiritual trauma, it's a season of mess, disarray, and madness. And if we're going to navigate in a season such as this mentally, I suggest that we should focus on two focal points that may help us liberate our mental health capacity. One, deconstructing a theological perspective or religious belief system that has dismissed or negate mental health and practices that can be useful in these moments. Along with Dr. Bonner, which will discuss some methods and interventions that may help us navigate through our anxiety, our stress, our grief, and other mental health disorders that needs to be addressed in the culture. First, I would like to discuss the theological formation of African Americans in the United States from a European privileged culture viewpoint. For far too long, the universal church have viewed mental health or psychological issues as sin or bad choices. Consequently, it has caused many individuals to fall into a deeper abyss of pain, of hurt, trying to understand their mental struggles. There's a book entitled Why Do Christians Shoot Their Wounded by Dwight Carlton, and he suggests that this type of mentality have only hurt the livelihood and the growth of the church. And so it is my belief, in order for us to be open or to negate certain stigmas that come along with mental health, I believe our starting point should be deconstructing a theological or religious perspective which promotes bondage rather than liberation. In saying that, so often when we study the Word of God or theological thought, we often see mental health or the stigma that something is wrong spiritually. I beg to differ. When we study the life, the practice, and the journey of Christ, we will discover that most of his miracles physically depended on a mental shift. Man's at the pool of Bethesda, been there 38 years, and Jesus comes across and encounters this man and asks the man would he be made whole of a physical disease. And Jesus raises a question that digs deep into his mental capacity. He said, will you like to be made whole? I suggest that this man was not only crippled, but possibly had low self-esteem and determination to be able to overcome some of the obstacles. There's another occasion we could see mental health at work. Jesus happened to be passing a graveyard, and there's a man who have been defined or identified as a man who has lost his mind. He's dwelling amongst the tombs. He's naked. He's cutting himself. He's having hallucinations. And Jesus speaks not to the physical, but Jesus speaks to his mind. Romans reminds us, be not conformed to this world, but be ye transformed by the renewing, not of your body, not of your spirit, but by the renewing of your mind. And if we're going to be able to navigate or liberate ourselves as African American people, our starting point is how do we see the Word of God and link it to mental health. I suggest that mental health ought to be perceived as not something that is wrong, but something that may empower us to become who God created. When we begin to study and understand the human being is comprised of three components: body, mind, and spirit. Through the European lens, we have been taught to focus on our bodies and on our spirits while we negate our mind. And so in this season of protests and COVID, let us reevaluate that mental health is not because a person has sinned or done something wrong. It's just like any other disease or malady that needs to be addressed in order to be made whole. And so today, I leave this. As African Americans, many of us, we shed or we run from mental health. It's because as African American people, we have displayed an energy, a tenacity of strength. And for us to say that we need help in the realms of mental health, it displays or appears to be that we're weak. Rather, that acknowledging one's weakness really reveals one's strength. And so in this season, Dr. Bonner is going to discuss some interventions and some approaches, how to identify some of the factors that we're being confronted with, such as anxiety, stress, grief, and even loss. At this time, Dr. Bonner, can you share with us?
Yes. First of all, thank you so much for having me. It's a pleasure to be here.
Our pleasure.
And to speak with you about mental health. When you look at the times that we're in, Dr. Edwards talked a little bit about things like the COVID-19, the virus that we know nothing about. That's foreign to all of us. 6 months ago, we didn't even know what COVID-19 was. And now we're seeing things from people getting sick and not even having symptoms to other people dying as a result of the COVID-19 virus. So it's normal to feel anxiety. It's normal to be stressed out because we don't know exactly what this virus will or will not do, or how it will affect us, our children, our families. There are a lot of uncertainties with COVID-19. People have lost their jobs, they've lost their incomes, they've lost family members. Some people are on the verge of being evicted from their homes. So again, the fact that you experience anxiety, depression, stress, those things are normal given the times that we're living in right now. I've had the pleasure of working in mental health for over 20 years. And I see with clients that I'm currently working with, I see an increase in those things. You know, many of my clients are struggling. What do I do? How do I live with this anxiety that I'm experiencing? What do I do about just in my normal everyday life? Not anything, you know, spectacular. I just want to be able to survive. And what does that look like? Again, I've still got to take care of my families. I got children to take care of. What do I do? So when we talk about anxiety and depression and stress, those are topics that we do address when we're working with clients and we're talking about mental health. Typically, they have been taboo within the African American community. It's the expectation, again, is that you maybe turn to the church. And there's nothing wrong with turning to the church. I mean, I think that we all can have our spiritual relationships. And I think those are important components of our lives. But I think it's also important to address your mental health, to make sure that you're okay. It doesn't say that you're weak because you're experiencing some anxiety. It doesn't say that you're crazy because you experience depression. Those are things that I would say any adult during their lifetime will experience anxiety, depression at some point. They don't change who you are. They actually, I think it's important, I think it's a strength when we realize, hey, I am experiencing some anxiety. What does that look like? How does that affect me? How does it affect the things that I want and need to do? And then to address those things. I think that's a strength. I don't think it's a weakness. I don't think that you're crazy because there are some days when you're sad, or there are days when you are crying, or there are days when you're isolating yourself, or when you experience days when you find it difficult to get out of bed, to go to work. Again, if you think about some of the things that we're experiencing right now, those things are normal. So one of the first things I would say to people is don't beat up on yourself because you are experiencing some anxiety, because you're about, hey, what happens if I do get this virus? Hey, what happens if my child who has asthma gets this virus? What are we going to do? Hey, I don't have insurance, so what am I going to do if I have to take care of myself and the rest of the family if we get this virus? Those are legitimate questions. Those are legitimate concerns. And they may keep you up at night. They may stop you from getting a good night's sleep because you're worried, because you're depressed, because you don't know what and how to proceed. So one of the first things I would say is don't beat up on yourself. But then also recognize how you're feeling and give yourself permission to feel those things and take care of yourself. And what I mean when I say take care of yourself, if you are feeling some anxiety, you may need to talk about those things. Understand what anxiety looks like and what anxiety feels like. Sometimes with anxiety, you may be irritable. You may be stressful. You may not want to be around people. You may worry excessively. You may not be able to sleep because of the things that you're worried about. And those are some of the symptoms of anxiety. Okay. Likewise, you may experience depression. Again, let me tell you a little bit what that may look like. Depression can be the fact that you're having a difficult time sleeping, or you may sleep too much. Depression can affect your appetite. Again, you may not want to eat and realize that you've gone all day long and you haven't eaten. Or it may be just the opposite. You may have you may want to overeat. You may be eating all the time, and then just the sadness, being tearful, wanting to isolate yourself, not wanting to be around people, it being difficult for you to be around people that you normally would hang out and have a good time with. Those are just some of the symptoms of depression. And again, you'll probably hear me say this a few times, don't beat up on yourself, especially during the difficult time that we're experiencing, that you experience some of these symptoms. Okay. So if you are feeling some of these things, I guess the next question is, okay, so what do you do? What can I do? There are a lot of things that you can do. One of the things is you want to start to look at your symptoms, and even if you have a support circle, people that you feel comfortable around and feel like you can talk to, you may want to start talking to them about how you're feeling. Sometimes, even though friends are well-intended, you may need to talk to a professional. And that professional could be someone like me who's a therapist, a licensed therapist, or it could even be your physician. You may want to start there. That may be the person that you know, that you have a relationship with, and you may want to talk with your PCP about how you're feeling. And oftentimes your PCP can recommend someone for you to talk to. Again, that would probably be a person like me. And we would give you an opportunity to kind of, talk about what you're feeling, how you're feeling, and help you to understand those feelings. We can also give you some interventions, some things that you can do. Sometimes one of the things that I sometimes recommend to my client is just calm, helping them to find a calm space, helping them to find some things that are relaxing for them, particularly if they're experiencing anxiety. Oftentimes with anxiety, my clients will say, this is how I'm feeling. I'm just feeling so jittery and so nervous and I don't know what to do. So if I could help them to find a calm space and help them to calm down. Because one thing about becoming calm is then if you can calm down, you can start to process things a little differently. You're giving yourself an opportunity to think things through. Sometimes when we're anxious, we're also impulsive, and we make decisions that we haven't given the time to think through those. So one of the things that we work on is just becoming calm, and what helps you to calm down. And then we can go through the situations that you're facing, and we can look at the different ways that those situations can be handled. We can lead you through that. What are the good things? What are the bad things? We're not going to tell you what to do. We're going to let those decisions be your decisions, but we're just going to help you to look at the possibilities. Again, because sometimes when you're feeling anxious or feeling depressed, it's hard for you to think through different situations. And sometimes you feel like, I got to do something. I got to get something done. I got to get something done. I got to get it done now. You don't always have to get it done right now. Sometimes we can pull back, we can relax, and we can give ourselves time to think about, how am I going to process this? What is this going to look like? If I do A, then what are the consequences of A? If I choose B, what are the consequences of B? And it's B, the outcome that I want. Is B an outcome that I can live with? And again, we'll help you process those things so that you can decide what's the best outcome for you and your family. Okay. So to just talk a little bit about mental health, again, I definitely am a proponent of everybody taking care of themselves. And I also would like to say it's not selfish to take care of yourselves. I know oftentimes we take care of everybody, especially women. We take care of the families, we take care of the husband, we take care of the kids, we make sure everybody else is okay. But in order to take care of those other people in your lives, you have to take care of yourself. And part of taking care of yourself is taking care of your mental health. So whether it's to give yourself 5-10 minutes just to be by yourself sometimes, so you can concentrate, so you can deep breathe, so you can relax. Whether you take those 5 or 10 minutes to put some headphones on and listen to your favorite music, and that's your time, and take some deep breaths, and give yourself that time away from everybody. Whatever taking care of yourself looks like, and again, we can help you to figure out what that looks like. You've got to give yourself permission to take care of yourself. And one of the last things I want to say is just about stigma associated with mental health. I know within the African American community, there's a lot of stigma associated with mental health. We often throw around words like crazy and weak. It's never weak to take care of yourself. I would like for you to think about your mental health like you think about your physical health. If you have physical problems, you go see your doctor, and then you follow up on those things that your doctor tells you to do. Well, think of your mental health in a very similar way. You have to take care of yourself. You want to address those things associated with the anxiety, address things associated with your depression, because if you don't address them, it doesn't get better. It doesn't change. It's just kind of like you're pushing it aside. And maybe for a short period of time, you feel a little bit better, but it still has to be addressed. It's going to come back. It's going to show up in some other form, either in your relationships, your job, in some other way that you're going to see those symptoms again. So take care of yourself. There's nothing wrong with taking care of your mental health. And again, I think it's a strength that we address our mental health. I think it's a strength that we tell our family members and our friends, it's okay. If you're feeling depressed, it's okay to get help with the depression. It's okay to talk about that. It's okay to talk about your anxiety. It's okay. Just like you talk about your physical health and those issues, and you address them, and you go to your doctor and you take, whatever recommendations they make, please do the same thing for your mental health.
Thank you, Dr. Bonner, for sharing on stress and anxiety. As we move forward, one of my concerns for the African American community is that we kind of reconstruct our theological perspective, particularly with the stigma that you have shared, that it's crazy, or from the church it deals with your decision, bad decision, or it is the result of sin. Mental health is just like any other ailment or disease. If we're going to be liberated, it is our mind that speaks not only to our hearts, it's our mind that also speaks to our spirit. So, in the words of Dr. Bonner, don't beat yourself up. I'll leave you with these words. Dr. Rita Walker suggests in her book that those in the African American community having the hardest time can be the least likely to ask for help because they are afraid of not appearing black enough. Don't allow your appearance of strength minimize not only your mental health, but minimize your life and your transformation. Again, we say thank you, take care of yourself, take time out for yourself in order to become liberated.
When
Thank
Jesus
you.
comes, when Jesus comes, when my Jesus comes.